Hello everybody, welcome back. Thank you for tuning in. How is everybody really feeling today? All right, I hope everybody's doing good in these times. I'm just going to talk about what to expect when you are expecting to have a knee surgery. If you are expecting to have an MPFL or a TTO or a lateral release, then these are the things that you will probably expect to happen. So, first, if you're getting this surgery, MPFL is a very successful surgery, and it's even more successful if you get it with a combination of other things such as a TTO, aka Fulkerson osteotomy, or a lateral release. Particularly, this surgery is done if you have patellar instability or patellar dislocations, which is something that I suffered with. When you get a surgery like this, you will probably want to expect to be out of work for a while, possibly 2 to 3 months, maybe a little bit longer than that if you, depending on your health, your age, how you normally heal from surgeries or anything of that nature. Another thing you'll want to expect is to have some knee stiffness. It will take a while to get your knee back to normal. Mine is just at a little over 90 degrees bend, and that's about 2 months and 2 weeks post-op. So I'm just getting at 90 degrees, and my physical therapist said he's hoping by the next couple weeks to get me at 100. I hope that I can get there because it's very, very tough. It's painful, and I try not to do it when I do my stretches or my heel slides. I try not to do it to the point that I'm in pain. It's sometimes a little bit just unbearable. I try to do it just enough to feel a nice, good stretch. So you'll want to make sure you are feeling stretch when you do your heel slides. Another thing is that the knee just feels, it's incredible. It just feels so tight. It's like a rubber band in there, and just, you just can't bend it the way you want to, but definitely keep up with that and the tightness should get better. So that is another thing to expect from surgery. The next thing to expect is some numbness. I also had a TTO, which is a tibial tubercle osteotomy, also known as a Fulkerson osteotomy, and that is when the bone is replaced a bit and some screws are put in just to help the stability of the patella. And I still have some numbness on one side of the incision. So definitely expect a little bit of numbness. It freaks me out. They said it should come back. I feel like it's coming back a little bit, but expect some numbness if you are getting that along with your procedure. The next thing is muscle spasms. So the most awful ones that I got didn't last long, but the worst ones that I got was after surgery. It wasn't terribly bad, but it did catch me off guard. The first night when my numbness, my leg block numbness wore off, and the pain started to kick in, my leg just started to spasm just because of the pain. I started to just shake all over because the pain wasn't very pleasant. But if you take your meds, that should hopefully get you to skip past the painful part, the muscle spasms. You may still have a few, but mine weren't awful. I've read some stories that people have had awful ones, but it's not totally bad. I'm now, with working out my quads as much as I do, I feel like I do get some muscle spasms, and I feel like maybe it could be in my head. I don't know. I feel like that is probably because my muscles are starting to wake back up and just like, hello, we're here, we didn't go anywhere, we're coming back. So I feel like that's why I'm getting muscle spasms now. They're not bad at all now. It just feels like a little thump in my legs, and I just feel like that's probably because my muscles are starting to wake back up. So you want to expect that as well. With my surgery, I did read that some people were off their crutches and walking by 2 weeks. I don't know who these people are. I was very much hoping that that would be my case. I'm currently just starting to walk with one crutch, and this is 2 months in, and I actually took a few steps without the crutch at my last PT appointment, which was 2 days ago. So I'm very excited that I'm going to be walking hopefully soon. And yeah, so just expect to just be on the crutches for a little while, and you'll get used to them. They do get kind of like a pain to carry around everywhere, but don't let that stop you from going out and doing things. It does get a little just annoying to carry them here and there and walking with them, but still try to still go out and do things, run your errands, make sure you have somebody with you that can help you, and just stay positive for the whole thing. So those are some things that I would say to expect when you get a surgery like this. I still do have pains where the MPFL was done. I definitely still have pains from that, especially with sitting with my legs bent at a 90-degree angle. It can be quite uncomfortable, and I feel the pain going up into my thighs. So it's definitely something to get used to. The next thing to expect to happen is muscle atrophy. Muscle atrophy is when you lose muscle that you haven't used in a long time. For me, I lost muscle really quickly in my quads, my upper leg, and in my calves. So that is another thing to expect. When you don't use it, you lose it. But your physical therapist will work with you really hard to build those muscles back up. So try not to stress too much over the way your leg looks, because it's going to look a little awkward. And also with this knee surgery, I was talking to my doctor, and he said it's going to take some time for my leg to look back to normal. I told him that my knee looks just so big, and you know, the upper part of my leg and the lower part of my leg just look really skinny. And he said it'll take the good part of it'll take about 6 months to a year to start looking back to normal. So hopefully it'll be 6 months though. I just straightened out my leg, and it is just the tightness. I think that's it. That's a wrap. This involved is one of my symptoms that I had in my surgery, and I think pretty much everybody will get if they are getting a surgery that's involved, is everyone, and welcome to my channel. That's a wrap.